Hi and welcome to my presentation. My name is Madeline Williams and I'm presenting on military and PTSD, and my perspective is a developmental perspective. The journal is Stressful Life Events Across the Lifespan and Insecure Attachment Following Combat Trauma. The key concepts in this are that it's from a developmental perspective, so meaning from infancy until death, PTSD, which is post-traumatic stress disorder, when you experience a major stressor and then have intrusion symptoms, avoidance symptoms, and a negative alteration in cognition and mood. Combat stress reaction is a bit of a differential for PTSD in this, just differentiating between acute symptoms and chronic symptoms. Insecure attachment from Bowlby we'd all be familiar with. So your insecure attachment includes your anxious and your avoidant attachment styles, as a reminder, and stressful life events being pre and post-war in this. So anything stressful that may have an impact on your attachment style was included in a questionnaire in this as well. This study examines the relationship between attachment style and acute and chronic stress symptoms. Ultimately, the question is, does a person diagnosed with PTSD or CSR experience insecure attachment following combat exposure or war? I think it's important because it considers a person's entire life, not just the traumatic event. And it's also important because it challenges past research that attachment style is fixed once it's established. So attachment is generally established in infancy, and previously we've thought that maybe that can't be changed. But some more recent literature and research, and definitely this study, seeks to challenge that sentiment that attachment style cannot be changed. So there's two main hypotheses for this, and they are that anxious and avoidant attachment will be positively associated with PTSD and CSR, and secondly, that stressful life events before, during and after the war will be associated with anxious and avoidant attachment orientations. That's discussed more at the results section of the report. The participants were Israeli war veterans that attended the Lebanon War. There was data collection in 83, 84 and 85 where the veterans were summoned to headquarters and had to complete questionnaires. And then the fourth measurement, probably the most important, completed in 2002, and that was around PTSD and also around whether or not they had an insecure attachment style or not. And that was done with informed consent. Ethics was obtained from the Medical Corps and Tel Aviv University Ethics Committee, although no indication as to if the ethics were done in the 80s or 2002. So that's a minor concern that I picked up on. So there's some details held in the table in relation to the participants. We've got the study group there and the control group, Israeli veterans, all matched in age, education, military rank, marital status, income level and the number of children to control for extraneous variables. The main difference is that the study group had a diagnosis of CSR and the control group did not have a diagnosis of CSR. Just to note at the bottom there around the response rate, because it's a longitudinal study, that overall there's only a 74.8% response rate. This slide contains a summary of the measures. The main ones that are important, I think, are the Experience in Close Relationships questionnaire. That was the measure that they used to examine insecure attachment and had a Cronbach's alpha of 0.88. And the other one that is an empirically validated psychometric tool was the PTSD inventory based on DSM-4. And that was to assess whether participants had a diagnosis of PTSD. The other ones there are more in relation to stressful life events and what the person had experienced across the lifespan that may have had an impact on their attachment style. So this slide goes over the two statistical analyses that were completed. Firstly, an ANOVA was done, IV, CSR and PTSD or not, DV, score on the questionnaire that measured the insecure attachment style. The hypothesis was only partially supported, so we saw a significant main effect for CSR on avoidant attachment, not on anxious attachment. However, for PTSD, both attachment styles, there was a significant main effect there. So in the second statistical analysis, there was two hierarchical regressions were conducted, and what we saw was consistent with the ANOVA was that if we have stressful experiences in battle, then that was a predictor of an avoidant attachment style in adulthood, or in 2002 in the follow-up studies, and also that in childhood and pre-war stressful life events, that was a predictor of only the anxious attachment style. I think summarised, CSR associated with avoidant, PTSD associated with anxious and avoidant. And the reasons that the researchers came up with worldview theory, so that combat includes the intentional killing of humans. So basically we're destabilizing the veteran or the participant's worldview. So whereas secure attachment requires trust in human goodness, war shows us the worst of humanity, so it unsettles that model. The second reason is that war doesn't stop at war, so your PTSD symptoms continue after the battlefield, intrusive symptoms, flashbacks, nightmares, etc. And this may have an impact on interpersonal relationships, unexplainable discomfort in relationships, projections of anxiety. We're looking at state trait anxiety then, and all of those factors come into play. And then the third one that was looked at is that they may have had a pre-existing disposition to an insecure attachment based on an early childhood experience. So we've got the strengths here as well of the research: large participant sample size, longitudinal studies and appropriate design for lifespan research, large amount of itemised life events. Data collected was at the time of war, so in terms of the CSR responses, it was really raw data collected at the time of war. On the right-hand side, the limitations, so baseline testing. It was my view that the study lacked a baseline test, so it would have been much better if we had had information around the attachment style prior to them going to war, so that we could then really know the true influence of combat trauma on the attachment style following that. Also, avoidance wasn't included as limitation in terms of sample size and people trying to avoid, or veterans trying to avoid, anything that was related to the war, which is a PTSD symptom, so that was possible in terms of explaining some of the response rate. So there were some self-report measures, and also there was no discussion in relation to cultural bias of trauma, and it was an all-male participant pool. So despite these limitations, there are implications for future practice. So changes in attachment style could become a focus in treatment for PTSD sufferers. Looking at interpersonal functioning may have an influence on the client's worldview, and then we may see some PTSD symptom alleviation. Also, the military could begin to consider these things and employ and screen based on secure attachment, if not provide psychoeducation or therapy to military members prior to going to war as a protective factor. And also long-term therapy and support should be offered to war veterans and post-war screening for insecure attachment, and that would be a way of improving their quality of life following war. In conclusion, PTSD often views a disorder that relates to an isolated traumatic event. I think this research is really important because it demonstrates that there's a developmental component. I also think that it could be generalised to other traumatic events that involve human violence, like terror, gang violence, or domestic violence. And I agree also with the researchers that it would be helpful to examine attachment styles at various points between the war and 2002 to see if there's any correlation or sort of concurrent occurrence that occurs between stressful life events post-war and also with an insecure attachment. So there's a few things that could be better, but overall I think there's a lot of value that can be added from this research. And there's a list of my few references. Thanks for watching and have a good night. Cheers.